Hello, everyone, and welcome. I'm Joseph Choi, healthcare reporter for The Hill. Thank you to everyone joining us today for a deep dive on The Hill Talks, the state of Medicare physician payments. I'd like to thank our sponsor, the American Medical Association, for their support of this discussion. As baby boomers age, the demand for doctors who care for seniors and accept Medicare insurance is skyrocketing. At the same time, the Centers for Medicare and Medicaid Services, CMS, has proposed an almost 3% reduction in physician payments this year, making it the fifth consecutive year of payment cuts. The medical community maintains that inflation, operational costs, and consumer prices have increased while Medicare physician pay has declined. How will another year of Medicare physician payment cuts impact patients? What are the implications if payments to doctors fall below the cost of delivering care? How do rising inflation, labor shortages, and the demand of an aging population affect medical providers? What impacts do these pay cuts have on the broader healthcare system? And what should Congress do? Today, we will examine these questions and more. Before we get underway, one housekeeping note. Please join the conversation on social media. You can follow us on Facebook, X, and Instagram at The Hill Events using the hashtag TheHillHealth. And with that, I'm pleased to introduce my first guest, Republican Congressman Greg Murphy of North Carolina, co-chair of the GOP Doctors Caucus. Dr. Murphy has also introduced bipartisan legislation to preserve Medicare for patients and doctors. Welcome, Congressman.
Good morning.
Good morning. So recently you reintroduced your bipartisan bill, the Medicare Patient Access and Practice Stabilization Act. Where do things stand with that?
Well, we are right now gathering co-sponsors. I think we're over 90 plus Republican and Democrat. This is a bipartisan issue, at least in the House. And we're moving forward. I'm having discussions with our Speaker and with the White House of making sure that this gets done soon, hopefully in the CR. Because truth be told, we're at a deadline. We are at a crucial point as far as funding for physicians, and if not now, when are we going to get this done? So I'm very optimistic we're going to get this done soon.
What is the biggest challenge to getting this bill passed currently?
There are a couple different challenges. One is funding, which is a relatively small amount. I think this is less than $4 billion, which is a lot of money. It is a lot of money. But in the grand scheme of things, a relative small thing. But sadly enough, physician pay has become now a partisan issue, at least over in the Senate. And we have a couple of folks over in the Senate, Senate Democrats to be precise, who are not really crazy about the throes, the difficulties that physicians are facing right now. I think there is a political issue almost as much as financial about with the direction of medicine. And so these are really hills that need to be climbed.
There's a $20 billion check for when Medicare has to be budget neutral. The AMA has suggested raising that. Is that something you feel could go towards supporting the spirit of your bill?
We actually have legislation to raise that. We submitted it last Congress to raise the limit from 20 million up to 50 million. There needs to be that window that they can work with when CMS calculates utilization, or when they look back and say, well, what happened in the last period of time? It doesn't need to be only $20 million. It should go up 50 million. Because truth be told, CMS and a lot of the utilization services that happen around Washington, D.C. oftentimes are wrong as often as they're right. So there needs to be a bigger cushion. So no, we have legislation already to do that. I'm glad to hear the AMA is supporting it.
You are currently the only practicing surgeon in Congress at the moment. What do you hear from your colleagues who are practicing medicine about the fifth consecutive year of payment cuts?
Well, I hear a lot, and that I still practice because I love doing it. I love my patients, but it also gives me an on-the-ground viewpoint from what's happening in medicine. Sadly enough, and at least as sadly to me, what has happened really with the ACA, it's driven more and more and more physicians into employment. Because heck, I ran a private practice for years, and this actually happened in my practice, where you're fighting around to find where the paper clips are to make sure you can keep the lights on. Going into hospital employment, the hospitals have been plussed up all this time while physicians have been continued to be cut. So, there's a great deal of angst that's going on. I'm soon to be 62. I'm still practicing, but a lot of my colleagues who are my age, who are in the private world, are just saying, I'm done. I'm enough with this. Younger folks are jumping into employment, which in my opinion is fine, but I think it's a less efficient, a more costly avenue of dealing with medicine. And sometimes there's not as great an ownership of patient care as would seen in the private world. So there's a lot of angst that's going on, primarily in the practice and private community, but also in employed communities, because again, that's a revenue source of how physicians get paid.
Right. And uh, to add on to that, what are the implications if payments to doctors fall below the cost of delivering care?
Well, I think the nuclear option is that we won't take care of Medicare patients anymore. You know, if and people don't understand this, I've had patients come in and apologize to me when they get their bill from Medicare and see what I'm paid for the services that I delivered. I've had them apologize to me because of that. So you'll either see retirements, you'll either see people just go into employment, which and vertical integration, which I believe is killing this country, or you're going to see more and more and more doctors say, sorry, I'm not accepting Medicare. And when surgeons start to do that, that is going to be the bellwether. That's going to be the canary in the coal mine that Medicare is no longer working to preserve access for seniors.
And physicians are saying that the costs of labor and
Yep.
the burdens of an aging population, what are the burdens that physicians face that frankly make it incompatible with, cutting Medicare costs year by year, Medicare pay?
Yeah, well, look at what's happened with inflation over the last 4 or 5 years. It's skyrocketed, and that's in every facet. That's energy costs, keeping your light bills paid, making sure that your staff is paid because there's a shortage of healthcare workers, and they get a chance to compete. So it's more and more money that goes to paying staff. Lots of all the other different things. Medical inflation, sure, way outpaces regular inflation, how much it costs for syringes or even medications, all these things that go into the mechanics of how you deliver care in a private setting or in an employed setting. But for that matter, the inflation component added to just the fact that you're getting cut for E&M codes is destroying your ability to deliver care, especially in a private practice setting.
We've discussed raising the threshold for Medicare budget neutrality, your bill just for inflation. What other actions can Congress do to ensure that physicians can continue providing care to Medicare beneficiaries?
Yeah, well, Medicare Advantage is one of the things that I think was started out with a good idea, but we're seeing abuses, and you see this in the Wall Street Journal, you see this in so many publications we've had absolute ridiculous abuses in the system. I think they may not be fraudulent, but I believe they're immoral. In some of the Medicare Advantage plans that are upcoding, they're data mining after a patient has been taken care of by a physician, throwing literally hundreds of billions of dollars of waste into the Medicare system. In that same avenue, the pre-authorization, the denials that we are getting is really, they're skyrocketing in and of themselves. And so all of these facets, not only the cost of just paying for your staff and everything else, but then having to hire more staff to fight denials, we're working on all of these parameters to make sure that physicians are actually spending the time doing what we're supposed to be doing, and that's taking care of patients, not worrying about how to pay the bills and not worrying about all the extreme frivolous denials that we are facing.
How are these cuts impacting, you've mentioned, uh, it just competes with the costs of running a practice. But, what are the true material impacts when it comes to physicians and their staff as well?
Well, you're learning to try to cut costs at every juncture to try to make sure you can pay the staff. Trying to keep staff on so that they're not, running to another practice just to get more money. It's a difficult time. And when I was running a practice, this is what I faced. But we're really at a crux. We're at a crucible where, gosh, if we don't fight these cuts now and we don't get them reversed, I don't see how private practice survives. Some want that. Some are pushing for the single payer system, and this is where some of the opposition comes, especially from Senate Democrats. They want a single payer system and to forcibly push physicians into that type of employment model. But it's just it costs more. It's a less efficient part of care, and I personally believe there's less ownership from physicians. And so you're hearing this all around in every avenue. I'm in the surgical lounge. I'm talking with other doctors about patient care. It's a major, major issue right now.
A huge trend we've seen in recent years is that private practices are essentially going out of business. They're kind of becoming this endangered species of a business. Uh, can you speak to, what other actions Congress can take to protect private practice? Because it does seem to be another aspect of the healthcare community that is under attack.
Sure. If you look at what the ACA was doing and all the push that it's done so much to give insurance companies control of what's happening in healthcare. And when they're doing this, they're cutting and cutting reimbursement to physicians for services that we're paying. They're following the Medicare model in the same way. But insurance companies also, you've seen a skyrocket in the number of denials that they go into. We're putting a lot of effort into that. We need to reform Medicare Advantage. We need to reform the denial and pre-authorization process. There's no way whatsoever if I get denied or if a patient gets denied a service or a medication that I've recommended, that I need to talk to a pediatric oncologist or a nurse practitioner about what's going on. We need a peer-to-peer review process. We also need one, somewhat of a gold card system. I think Representative Burgess put that out last time, that if physicians are really doing it right, they're not ordering a lot of tests, they're being appropriate about that, then they're not pushed on as far as denials and authorization issues. There are a lot of things that we are doing to try to make the world of private practice still tenable. There are a lot of forces that, again, want to push us into a single payer system, which I think is wrong for everybody.
Would you be able to expand a bit more on how rising inflation and how bad labor shortages are currently for, physicians such as yourself or others in the community who are trying to continue to provide care for Medicare beneficiaries?
Sure. The first 15 years or so that I was in private practice, we had people, staff members that had been with us the entire time, all 15 years. Now you're seeing a much more transitory environment where people are jumping from job to job because, hey, all of a sudden now that person will pay me more, or I can go and do something else. We're seeing a shortage in so many different fields, ultrasound techs, CNAs, a lot of different things where we're having folks who are not coming into the healthcare system. And so that shortage of supply with an ever increasing demand is really causing wages to go up. We're having a real difficult time, not only with recruitment, but retention, and really trying to take care of our employees, not only through salary, but some of the other benefits that we deliver to them is going to be critical to keeping a defined workforce, that one that stays. If you look at all the different parts of inflation, medical inflation, it's ridiculous what some of the medical device companies charge us for some instruments and some of the other things that go on. There really needs to be a full reset, and I'm glad we're hearing that word say a lot here in Washington, D.C., of where medical costs are going. Now, some of it has to do with physicians not ordering too many tests, which I blame on some of my colleagues and the mid-level providers too. But we also need to look back and say, hey, what is a reasonable cost for a lot of things that go on with medicine? Some of the device companies and other folks really need to have an accountability to that issue.
All right, well, thank you so much. That's our time. Thank you again, Congressman, for joining us today to discuss this important topic.
Great. Thank you.
Thank you.